Let's do a question. A 58-year-old patient undergoes angiography to evaluate his coronary arteries. The cardiologist notes that the patient has a left dominant heart. Which artery does the posterior interventricular artery arise directly from in this case? And you should be thinking of the circumflex. The circumflex vessel is going to be the second major branch off of the left coronary artery. The primary branch coming off of that would be the anterior interventricular. In a left dominant heart, the posterior component of the heart is going to be supplied by the circumflex, which typically would end around the ventricular left side. But in this case, it will be dominant and will carry around to the posterior interventricular artery. This is not as common as being right dominant. During thoracic surgery on a patient that had been injured in an auto accident, the surgeon gently elevated the esophagus off the vertebral bodies and searched in the mid-thoracic area between the azygous vein and the descending aorta for any injury to the structure located there. What was the structure she was likely checking for? And the answer here would be the thoracic duct. The thoracic duct can sometimes be injured in thoracic surgeries because it's a very thin-walled structure that ascends just posterior along the vertebral bodies, and it will ascend typically between the esophagus and the aorta, or sometimes the esophagus and the azygous venous system. Since it's so delicate, tearing of this during thoracic surgery can result in a chylothorax, which is often the reason that brings them back in looking for damage for it.